It's so important to go to a class if you're having one of the major surgeries like a joint replacement or a spine surgery, because all of us don't know what we don't know. And it's a place to learn things that you might not even realize you had needed to ask about. We want to make sure our patients are as prepared as possible, because that is the best thing for them. They're going to know how to be involved with their care in a different way after they go to a class, and they have to be involved in it. And we want to show them how to do that for the best outcome.
At OrthoColorado, we try to give the guests the best experience that they can, the patient and their family members. So we tend to go over and above what you would expect at any other facility that you're at. The role of the concierge is to make you feel welcome when you come in. We want to put you at ease when you come in. We want you to know that your family is being taken care of and that you've got nothing to worry about while you're here.
Welcome to OrthoColorado Hospital. My name is Mary Ann, and I am one of the preoperative and recovery room nurses here. I have been a nurse for 26 years, and I will be one of the faces that you probably will see when you come here to prepare for your surgery. When I bring you back into the room to prepare you for surgery, this is the room that you will typically see. I will invite you into the room. I will most likely have you sit on the bed, and we will talk about a few things that are important to me to really understand better how we're going to prepare you for surgery. Once we've gone through all of the questions with you, we will step out of the room, and what I would like you to do is I will have you put on one of our designer gowns. Then you can expect to put on some little accent socks for us. You'll be putting all of your belongings into this bag that we provide for you. One of the things you can expect from us here today is that we will put some sequential compression devices on your calves. The purpose of these is to shunt the blood back towards your heart. It will pump one leg at a time, and that way it assists us with helping to prevent blood clots. This sequential device will follow you not only into surgery but out into surgery and upstairs if you're staying with us. After we get you into the bed, we'll get you comfortable with some warm blankets and have you lie back. We'll start your IV. That's important that we provide some fluids for you. You can expect us to take your vital signs. We'll be using the monitors in order to look at your basic vital signs, and if we need some additional monitoring for other procedures, you can expect us to use the monitor as well. One of the things that you'll notice when you come into your preoperative room is our communication board. Our communication board provides you with information about your surgeon, your nurse in the preoperative area, your assigned anesthesiologist, the surgery that you'll be having today, and the times that you can expect for your surgery to take place. The additional piece here that we invite you to participate in is questions and any concerns that you might have for any of your team members. Your family is also invited to ask any questions or concerns, and you, your family, or the nurse will write those concerns on our communication board so that our team members can answer those for you before you go back to surgery. Once we have you comfortable in the bed, we'll invite your family members back here into the room so they can spend time with you. At that time, you're going to notice that you are going to have a multitude of people that are going to be entering your room one at a time. This is all part of your care team that helps us to better communicate with one another and make sure that you receive personalized care. One of the people that you can expect to enter your room is your anesthesiologist. They will come into the room, they will speak with you and your family, they will answer any questions or concerns that you might have about the type of anesthesia that you'll be receiving. Once you have spoken with them, you can expect perhaps a massage therapist to come in to just relax you a little bit, make you feel a little more calm and comfortable as you prepare for your surgery. Your pharmacist will also talk to you about medications that you have been taking and medications that you were asked to stop taking perhaps a week ago. Once we have that information, that also helps us to provide you with the medications that you may need throughout your stay here with us. Your surgeon and your surgeon's PA may also visit you. They will come into the room discuss any last-minute concerns or questions that you or your family members may have. At this time, they will mark the operative site, which is one of the safety measures that we have in place. Once they leave the room, we will be very close to preparing you to go to surgery, and your team will get together. They will talk about all of the particulars of your case, and we will be communicating not only with the operative team but also with the recovery room team to ensure good communication that provides you with personalized care. Another safety measure that we have in place is an identification band that you will receive and that will be placed on your arm. That information with your name and your date of birth will be asked by all of your care team members. That is just a way that we ensure safety and precaution here at OrthoColorado. Before you go back to surgery, your operative team will come in. They will introduce themselves as well, and they will also ask you many of the same questions that you have been asked already as you prepare for surgery. Once your operative team is happy with all of the information and they are prepared to take you back into the operating room, they will invite your family members at that time to provide hugs and kisses for you as you prepare to head back to surgery.
Some of the more important things for you to remember as a patient are, number one, to follow the no eating and drinking restrictions. That's for your safety ahead of time for surgery. We usually ask that you do not eat or drink after midnight, and your anesthesiologist may specifically instruct you if your surgery is later in the day that you can relax those restrictions. But if you do not directly talk to your anesthesiologist ahead of time, we ask that you do follow the nothing to eat or drink after midnight restrictions. Just as a reminder, that does include things like chewing tobacco, chewing gum, and breath mints, so please don't use those as well after midnight. Second most important thing that you probably want to know about is that we want you to take the medications that you were advised to take ahead of time, as well as hold the medications you were advised to hold. Again, that's for your safety in the perioperative period. The third thing that we'd like you to know the night before surgery is that you are in good hands here at OrthoColorado Hospital. We have a specialized team here to take care of you, and we want to ensure your safety. Probably one of the more common fears that people have is just anxiety associated with having surgery. Our job from anesthesia is to help relieve that anxiety for you, both with our conversation that we have ahead of time, as well as with some medication if you need it to help relieve that anxiety. So second of all, we just want you to know that anesthesia is very safe. We may ask for a few additional tests or consults prior to your arrival here at the hospital to ensure your safety, but overall anesthesia is very safe. Third of all, patients have oftentimes had a bad experience in the past with anesthesia, and we just want you to know that we will try to help formulate a plan that tries to minimize the bad things that have happened in the past to you, as well as ensure that your safety in the future. Last of all, we want you to ask questions. We do like questions, and we want you to understand what we're doing for you and why, and please ask any questions that you do have.
Welcome to the recovery room. Now your surgery is over. Your operating room team will bring you into the recovery room here. This is very typical of what you will recognize. Things that you can expect once you're here in recovery is that your operating room team will come in, they will address your recovery room nurse. They will each give a full report to her so that she can assume your care. Once she assumes your care, you will have one-on-one care with your recovery room nurse. You will be hooked up to quite a bit of monitoring equipment. You will also have oxygen at this time, and you will still have IV fluid running. Your recovery room nurse will then begin to assess your vital signs, talk to you about your pain level, and document any information that's needed on the computer. When she feels that you are stable, that you are more awake from your surgery, she will then invite your family back for a short 5-minute reassurance visit. This enables you to see your family for a short visit. It also enables your family to know that you are doing quite well here in the recovery room. This begins what we call phase 1 of recovery. Phase 1 of recovery allows us to continue to monitor your vital signs, make sure that you are stable, that your pain is well controlled. When your recovery room nurse feels that all of those things are in place, she will then begin to move you to what we call Phase 2 of recovery. If you are an outpatient and you will be going home that day, she will move you to the Phase 2 recovery area, and then she will begin the process of inviting your family back to spend permanent time with you and also begin the discharge instructions at that time. If you are going to be staying with us overnight and she feels you are ready to go to your room, she will then call your family at that time, let them know what room you will be going to. She will give a full report to the nurse that will be receiving you up on the floor, and then you will be transported in your bed directly into your room. Your family will be there to greet you once you are in your room. If you are going to be leaving and you will be discharged that same day, the instructions for recovery will begin at that time. That is what we refer to as Phase 2. Phase 2 enables you to have a little something to drink, a few snacks, and to perhaps be sitting up in a chair. We will remove a lot of the monitoring equipment at that time, and we will be talking with you and your family in great detail about your specific instructions for your assured recovery. If you are the family member that is accompanying the patient, it is particularly important that while the discharge instructions are being provided, that you pay close attention, as you will be the one that is caring for your loved one once they leave the hospital.
We see patients when they come in preoperatively before surgery. We go over their home medications with them to ensure they haven't had any medications that would increase their risk of bleeding, and also to make sure we have an accurate list of home meds so that when they're inpatient, we can continue those same things that they are on at home. We are actually behind the scenes working and communicating with your healthcare professionals to make sure that the medications you receive are safe and effective for you. You might see us come in if you have a question or an issue about a specific medication. We're always available to answer those.
On the day of your discharge, we spend a lot of time, specifically me, I spend a lot of time educating you, and not only you, but all your loved ones, your family members with you, because again, they're taking you home and they're your home nurse while you're at home. So we spend a lot of time. I come into the room and I spend time going over what the expectations are, what it looks like for you for the next 2 weeks as far as your recovery with pain, with swelling, and we go over several different techniques and tools you can use when you're at home to really expedite your recovery and heal well. That would include therapy goals and what the expectations are for therapy for the next 2 weeks, when your follow-up appointment is with your surgeon, and any concerns that you have and whom to call so that everybody's comfortable with your with going home and that you're safe when you're home.